Ladies and gentlemen, welcome back to the Dog Talk Podcast with Dr. AJ and Dr. MJ. What's up, buddy? How are you? Guess what?
Got a special guest, man.
Very, very special guest today, Dr. Maria Scunziano-Singh, the one and only. How are you, Dr. Maria? Nice to see you.
Good.
Nice
Great
having
to see you guys.
Thank you so much for inviting us to this beautiful center. I mean,
gorgeous.
This is just, words can't explain the way, this is just absolutely stunning.
It's really, I feel like it fits you so well.
Yeah, it does.
Yeah, I wear
Because
it.
we were
I
around
wear
you
it on a
before
regular
it was
basis.
built.
She does wear it on a regular basis.
I wear it well.
You really do, really. So tell us a little bit about what was your dream before opening up the center? I mean, was this something that you kind of wanted as you were growing up? Say, you wanted like a health center or a welcome center for your patients?
Growing up, well, it wasn't quite that early.
Yeah.
It was sort of later on as I finishing up my training and working out, how I'm going to do this. How am I going to have parallel worlds? How am I going to have conventional and naturopathic type of medicine,
Yes.
working side to side or side by side,
So
and
hard.
or integrating it.
Mhm.
Right? And I needed to have a space and a place to be able to do that because a conventional doctor's office,
Yeah.
as you know,
Yeah, of course.
has only certain things in it,
Yeah,
and
resources.
certain tools and
Yeah.
resources. Right. So we needed a place.
Hmm.
I feel like people
To
don't
be able
have
to
the
do that.
option to
Yeah.
go natural. Like even if they wanted to, it was difficult until you created it. Really wasn't much options out there.
Well, I'm pretty much a rebel. I'm
You are.
going to go out on a limb. I'm going to do what I have to do and to get what I want.
Yeah.
I
You're
remember
great
when
at
they
that.
used to bring up the donuts and run, hide the donuts.
I'd be
Hide
scared
the
to eat
donuts from
any
me,
kind
yeah.
of meat.
Hide the donuts.
I know,
Yeah.
hide the donuts, hide the meat.
And then a week later, they come in with fruits. Where's Dr. Maria? Here's the
Yeah,
fruits.
exactly. And then she's not there.
Yeah.
course.
So the transitioning into a more natural setting was not too difficult for me because that's what I really wanted to do. I wanted to be able to take conventional medicine, the traditional pharmaceutical, surgical approach, and either add to it or kind of subtract a lot of it and
Yeah.
add more of a more natural approach, which is all encompassing. That is, it has so many aspects. There's so many pieces and parts to natural medicine.
Yeah, absolutely.
You have a tremendous amount of option there. And that was kind of pushed aside when conventional medicine came around the early 1900s and took over all of that, which used to be. I mean, we used to have herbal
Natural.
medicine,
Yeah.
using energy medicine,
Absolutely.
using the sun, the elements,
Yep.
the water, and all that to heal people.
Yeah, and for pharmaceutical companies, kind of took over. And
I
Took
feel like
over.
though it's coming back a little bit. Natural medicine.
Yes.
I feel like it's getting.
I agree.
It's
Yeah,
coming
it
back.
is.
A lot of people are
Definitely.
going into holistic medicine. Like
I think it's the
times
awareness
have
too, right? I
changed,
think
yeah.
people are just more aware
They're tired
of
of
their
side effects.
options. So of
people
course,
are tired of side effects. They're tired of the natural, like the same routine that our doctor giving you.
exactly. And a lot of these medications will treat one thing and give you 5 side effects. You see what I'm saying? And they're sick of that. But
Literally.
Yeah,
sick of it.
literally.
Exactly.
Right.
So let me ask you a question: Is the holistic approach and the natural approach is pretty much 100% of your practice?
Well, I call it integrative.
Okay.
Okay. So as part of our Welcome Om Center,
Mm-hmm.
its official title, Welcome Om Integral Healing and Education
Mhm.
Center, it's all about putting it all together. So I use the alternative as the complement
Mhm.
to the conventional,
Mhm.
but I generally do that in my conventional office. Okay, let me straighten this out.
Yes.
In a conventional office, Access Healthcare, I add and I complement using my knowledge, my diploma and so forth in naturopathics, to complement the drug scene. So I try to reduce the pharmaceuticals, the drugs, or reduce the chances of a person going for some invasive procedure. And I'll tell you a wonderful story too about that in a moment. But I reduce the amount of invasive and or pretty harsh treatments with all the side effects, as you said.
Yes.
5 is you're just touching the surface.
Yeah,
A
absolutely.
lot of drugs have, can have anywhere from 50 to 100 different side effects.
I agree. I agree 100%.
So, so I'm complementing. So we have this whole thing called complementary alternative or CAM medicine. And complementary is essentially that which complements conventional, and alternative is an alternative to the conventional.
Yeah.
So there are differences, but
yeah.
when we combine complementary and alternative, it's kind of an integrative approach. And that's my thing.
Yeah.
I can always fall back on the pharmaceuticals if I need them.
If you need them.
So I want to use them as a kind
Backup.
of last resort or backup.
Yeah.
Because the average person now, as you said, there's more awareness and people are seeing what's going on in the pharmaceutical industry. They don't like it.
They don't.
And it
I don't
makes
like
them
it either.
lazier, right? Like I feel like if you know the medication is there to fix it, like somebody has acid reflux, the first thing they're gonna say is give me a medication, right?
Yeah.
Instead of changing their diet, trying something natural. There's so many steps they're skipping because they know it's the easy route, right?
Correct.
Yeah, I feel a lot of the issues is that you'll have patients who are just chronically ill if they're diabetic or hypertensive, and they've been on medications for years who decide that they want to change. I'm sure you see a lot of that in your office where they've been on treatments and say, well, how can I approach this from the natural standpoint or like a holistic approach? And this is something personally that I deal with my patients. And it's kind of hard to, if your A1C is elevated or your blood pressure is really high or you're morbidly obese, how do you approach those type of patients if they just want to switch over to a holistic approach? I mean, where do you even start? Because, it's going to be kind of hard.
Yeah. Well, I'll tell you, we have a lot of people who have really failed in the conventional approach.
Yes.
The conventional approach being drugs, surgery, and other invasive measures. The integrative approach and or using like CAM, right, complementary alternative, you are really approaching the disease from a complete and total perspective. So we call it holistic, right? Yep. You look at the whole person, the WHOLE person, and you put all that together. You learn everything about them, right? And you get into not only their, what was your father and mother suffering from, and what are your sisters?
Of course,
you get into their diet, their social life, their spiritual life. What are their practices? What do they do on a daily basis? And you look at these things. You look at all of the elements that could be contributing to their disease, right? And again, most of it is diet and inactivity.
Yes,
and
sedentary.
So there has to be an intention of that person. That person has to want to say, I would like to change. So I do suggest it to most of the people that I see. And a lot of people I see, they've known me for a while, so they already know, hey, I'm going to get something from her about what else I could do in a more, natural approach and not using the drugs and so forth. So, so we look at everything. We talk to the person. I talk to a person, and I'll find out if you really have the intention, and you're going to stick to it. There has to be a stick-to-itness.
Of course, it's consistency. You have to be consistent.
You have to be consistent,
and you're not going to get quick results.
No, and sometimes you can though, MJ. You sometimes can. So, so we have to understand that conventional medicine, as it stands, has failed as far as chronic illness.
Yeah.
So, CAM medicine or integrative medicine is a world where we really deal with chronic illness, and we can take away the chronicity if we start looking at different points and aspects of somebody's life and make those changes with them. So it's a doctor-patient relationship. It is very patient-oriented. It's about their life.
Yep.
It's not about what I am going to throw on you. You tell me, you give me this information, and you basically will answer your questions.
Yes.
Like, yeah, I do. I don't exercise.
Yeah,
I
exactly.
really eat junk. I'm eating at night.
Don't
I eat
sleep,
late.
but,
I don't sleep. So we come up with a plan for these folks, and that's really what it is. It's like, I'm the planner. I'm the one who's kind of coaching you how to
guiding them exactly
how to live your life.
Yes.
So we do that here at the Ohm Center, and we have some amazing people who are here with me doing wonderful stuff. Because I could be the coach, the counselor. I do other things like chelation here.
Oh, nice.
So chelation helps take metals and toxins out of the body. Helps actually reduce cardiovascular problems.
Yes.
And I'm going to tell you, I had a wonderful experience just recently. And a young, relatively young lady, middle-aged lady who had vascular disease. Blocked arteries here, blocked arteries in her legs. She said, Doc, can I do chelation? I said, you sure can. And 15 treatments later, we checked everything. The stenosis had been gone.
Wow.
All the legs are clear.
Wow.
And I have the report.
Wow.
So I think this is going to be a case
That
study.
is amazing.
So the chelation really cleaned her up. And so what does she avoid? Invasive,
of course.
Stents,
infection,
bypass,
risk.
Yep. So really beautiful story, and she was excited. We were all excited. The whole team was like, yes. But we do great chelation, nutritional infusions, detox.
Excellent.
I do pure bioenergy, which is like a form of Reiki. Yeah. And those of us who do it, we call it Reiki on steroids. So it really has a powerful effect on pain control and things like that. We have wonderful massage therapists.
I heard great things about that.
We have a lot of our patients that come for the massage therapy here also.
We have massage therapists.
Acupuncture also.
They do acupressure and cupping and things that go back to traditional Chinese techniques.
Yes.
And traditional Chinese medicine is in and of itself, it's a world of medicine. Yeah. That's one thing
that's a whole different
that we bring in elements though of Chinese medicine because it involves herbs, it involves acupressure, it involves meridians, and all that. We have a hypnotherapist who helps those with PTSD and anxiety and depression. She's wonderful. We have a life coach here, so they're part of my team, and then we have somebody who does bioelectromagnetic energy resonance.
Wow,
that's called BEMER for short.
Fantastic.
And that's for pain, improves microcirculation, helps inflammation, energizes people.
How about nutrition?
Nutrition,
also,
that's my thing.
That's the toughest thing that we try to get. And it's because really, we say it's hard to find them, but it's really the patients don't really want to change. If you want to change, especially in 2022, everything is out there. You can learn. If you really want to learn to eat healthy, you can learn to eat healthy.
Well, that's part of what I do as a coach, as a therapist, as a physician. We're teachers, right?
Yep.
Doctors are teachers. So we have to teach these people how to eat from step one. I have to take them and have them understand that you have to eat this amount. You have to cut your food a certain way. You have to prepare it a certain way. You have to chew it right. You have to eat it peacefully and make the best decisions. So it's a whole process.
It is. Learning.
What would you say to somebody that says, I can't afford it?
There are many ways to afford it.
I feel like everyone uses that. Doc, it's too expensive. I can't eat healthy. It's easier for me to get 99 cents McChicken,
Right.
Yeah.
Well, again, it's the lack of knowledge and understanding. There's a kind of like an ignorance factor. If you don't know, you don't know, and you need to know. So these people are kind of hungry to know. They want to know how to, and growing one's own food, getting involved in a co-op, farmers markets. There are different ways of getting food less expensive, and not being lazy is the key.
Of course,
laziness is the biggest sickness that people have.
If you're lazy, you can come up with an excuse for anything. It doesn't matter. I got to teach people not to be lazy. Right. So convenience has become the thing. And it's gotten to the point where it is a disease in and of itself. We should put that down as one of our DRGs, convenience as a big case of it.
For sure.
So we have to teach people the ABCs. I have to teach them how to eat, to breathe, how to drink, how to move, how to sleep.
Baby steps initially.
And how to interact with other people.
Yeah, absolutely.
Because they're so used to the same routine that they've had their whole life. So you have to change it from the beginning, like you said. Yeah. If you don't go back to step one, it's not going to change.
Yeah, but it's all consistency, like she said earlier. It's all consistency. It's all about preparation, and you need the willpower to actually want to do it. Because the majority of people, if they're lazy, they're going to go to their primary care physician and here, take this medication, it'll control your blood sugar, and continue doing the same exact thing. Yeah.
So we teach people gardening here. That's one of our number one features.
I should tell my mom to come here. She would love this.
Right. So we have beautiful landscape, and we have people who teach about how to, and we want children and people of all ages. to be here. We would love kids to be here to see how it's done, because kids don't know how to
with
grow things.
Yeah, they really don't. They really don't.
They don't know
They should
what
teach that in school. That would be actually a really kind of a cool
They
thing
should.
to
Well,
start with, right?
I guarantee you, they know how to get on their iPad and just log in to all these different websites.
Well, if I get anyone here, I tell them all about the problems with that whole aspect. The radiation factor, how it's hurting us. That in and of itself is a whole discussion.
Yeah.
We can go into that for hours with me. And telling people what the real dangers are, just your iPad, your cell phone, what it's doing to you.
It is. I agree with you.
But on to better things. We have yoga, we have Tai Chi, we have
Zumba,
we have sound therapy, we have wonderful, sound bowls.
Wow.
The frequencies, they're powerful, and people really can heal. We have regular ongoing lectures. I usually give a lecture once a month. We have nutrition classes. We're hopefully going to open up a cafe very soon.
Oh, that's pretty interesting. Now, is this open specific hours, or if I wanted to come on Saturday, can I come?
Yes,
really?
You can. So we're open 6 days a week.
Okay.
We start out 8, 9 o'clock in the morning, I think.
Yeah.
We're early, and then we usually close at 5 on most days of the week. Thursdays we're open until 7.
Okay,
so for
interesting.
people who need to come a little later because of work and all that, and they can't get off by 5 or whatever, or earlier than that. So we're open. We're open 6 days. Saturday is like 10 to 2.
Okay, so a few hours on Saturday. And do they need to call ahead of time, or can we walk in or talk to somebody, or somebody greet?
You walk in anytime. People can walk the grounds here. It's really open to everyone.
Too, right? So.
And and you can, if you need to make an appointment, like say somebody wants to make an appointment with me, or an appointment with one of our therapists, or wants to schedule for a class, well, they can call, or they come in, physically come in, or get online and check us out, and then book some appointments. Yeah, we have all that.
Well, we're really excited, and today actually we are going to be doing a Zumba class, which is going to be pretty fun. And I wanted to thank you for allowing us to come here to this beautiful center and for joining us. And I can't wait to do this again with you, honestly. And do you have any questions for us, or anything you'd like to talk about?
When are you going to come and change your lives?
We're
getting a little bit healthier. I feel like
I have lost some weight in the past few months, and I am doing a lot better. Thank you so much. I am eating a lot better. I do a lot of yoga.
I love that you instill it in your kids. That's what I noticed. Like, they get excited when they go to somebody else's house because they have candy and stuff. But AJ's no candy.
Yeah, I don't have anything.
Everything
in the
is
house.
Healthy. Water, no Coke, no. And it's I love that he's setting the example early. Because most of your kids now are like, they're healthy, and it makes a big difference so that you don't have to deal with it later on in life.
The problem
is prevention, right? It's not like wait until you become a diabetic, wait till you have a stroke. Why?
Yeah, so start early. Well, what I try to do is I give them types of healthy foods that they like instead of, something that they're not going to eat.
Yes.
And there are alternatives to Oreos, to cake, to all these. You see what I'm saying? Fruits, vegetables, delicious fruits and vegetables. So, and that's what I try to, even with my patients in the office too, I try to push them as much as I can, but there's certain people, unfortunately, that just
education.
Yeah.
You got to want to do it. Without wanting to do it, it's not going to happen.
Exactly.
Yes. You have to have the intention, and then start setting a plan and your goals.
Yeah, for
a healthier life.
Yep.
And it's all in your hands.
Yeah.
Really, it's all in everyone's hands.
And I tried also to emphasize to my patients, it's not always just about losing weight. It's the way you feel, and that's what I love about that. Like yoga or exercise or eating healthy. You're not bloated. Your headaches are better. You sleep better. We got into yoga, so we do a lot more yoga.
Really
it's
nice.
helping me de-stress a lot. So thank you again, Dr. Scunziano. We love you so much, honestly, and we
guys,
cannot
make sure
wait
you
to
go
do this
follow
again.
the Welcome Home. It's on Instagram, Facebook, and check it out. I'm sure there's a lot of things that you would love on there.
Absolutely. We'll leave all the information also.
We also
in
actually
the
just
video.
got tagged in one of the Instagrams, so you can also just click on that and go straight to the page.
Perfect. Thank you so much.
Thank you.
Thank you.
Dr. Scunziano, thank you so much.
Thank you so much.
Appreciate it.
Thank you. God bless you.
guys.
Have a great day, guys. God bless.
Awesome.